So at this moment, the World Health Organization and the U.S. Centers for Disease Control and Prevention acknowledge that the COVID-19 could be transmitted through different routes, such as through close contact, and therefore social distancing of 6 feet or 2 meters is very important. Then the recent results confirm that the transmission through airborne, which means that the droplet could be hanging in the air with a very small size in terms of micrometers. And this could be transported from one person through the other according to the airflow inside a room. And this part becomes super important because in the United States, in the beginning, the government did not encourage the use of masks. And now we are in a very bad shape because of the spread of disease. And therefore, the Biden government now really signed executive order and encourage people to use masks. Then the last one, of course, is the so-called formal transmission. For example, if I am a COVID-19 patient, and then I cough on my hand, and then my hand touch the computer keyboard, and then later on someone else touch the computer keyboard, and then he touch his nose or mouth, and then get the disease. So all the 3 routes are very important. And people are very easy to obey the rules on the distancing and could really watch the hand carefully. However, for the airborne disease transmission, that's always a concern, and some people don't believe this is true. And therefore, it's really my intention to show you some evidence of this type of transmission through airborne disease. This animation shows the distance of 2 people is 2 meters, right? And on the left side, you see the scales, which is the size of the transmission, size of the particles, which ranging from submicron to like 200 micrometers. And that's a typical particle size generated by a cough. And then you can see from this animation, large droplets typically will go down to the floor. And therefore, if you stay like 2 meters away, you are not dangerous. So you could really not get the disease because the large droplet will not project to your breathing area. However, you see those green particles, which are less than 20 micron. So they can travel very long distance, and definitely the 2 meters social distancing is not enough. And therefore, we are going to focus on this part of particle transmission. And today, I'm going to use the examples in the airplane, because most of us have traveled by airplane, and I often been asked by my colleagues and my friends, is it safe to travel by airplane? Okay, so let's look at what the airplane situation. So this is the air distribution. Normally you see in an airplane. This is a Boeing 767. So if you do look for other type of airplanes, the airflow pattern are more or less the same. Okay, so what they do now is to supply the air in the upper part of the cabin, and then this is supplied with the jet, which form very strong recirculating in the cabin. So this design is pretty good for thermal comfort, because you try to mix the hot air supply or cold air supply from the air conditioning system with the cabin air, and then you get uniform air temperature distribution. However, this type of air supply is really terrible for COVID-19. That is because if somebody generated the droplet virus in this air cabin, and that will be brought, recirculated and brought to other passengers. And I like to use two examples to illustrate the transmission of airborne transmission in airplane. So the first example is much more proved example because this has been studied by many people in the past. And this case is the SARS case in 2003 in a flight from Hong Kong to Beijing. So in this 2.5-hour flight, an index patient, the index patient sits on this seat 24E, and this super infector spread the virus out and infected more than 20 fellow passengers in this cabin, which is in dark color. And as a result, 4 of them died. And you can see the most infection, it happens in the proximity of this infected person, just within about 3 rows. That's according to the US CDC guideline. So because the air conditioning system in the plane design, you could have a very strong recirculation in a cross section, but not in the longitudinal direction, because this is the plane designed to minimize the transmission of contaminants there. Then we try to do this study by using computational fluid dynamics, or CFD. And I want to show you the principle of CFD. Okay, CFD, we solve the Navier-Stokes equation. And I take this very simple clean room as an example. So why I use this room, because a Japanese researcher did a very detailed study on this room, and therefore they have data we could use to validate our model. Okay, so first we calculate the airflow distribution in this clean room, the air supply on the ceiling and return on the floor level. And you do have some type of recirculation there. And as a result, we can also calculate the virus concentration. So in this case, they release a particle somewhere here. So you can see that this is the particle concentration calculated by using the Irradium model. And you compare with the measured data, they are in pretty good agreement. Now, we haven't used this model before, but today I'm going to show you a different model. This model is the Lagrangian model, which could track the individual particle motion, as you can see through this animation. So when the particle releases in the source, and of course the air will bring these particles in different parts of the room, and you can see particle concentration in different region is different. So finally, you can calculate the particle concentration, and I got the result on the lower right corner here. And you compare with the experimental data, they're again similar. But with the Lagrangian model, of course, we get more detailed information, and that's why I like to use this one to show you the result. Now let's go back to the flight, okay? And now we assumed if, let's say, a passenger sitting in the middle who coughs out the particles in different sizes, and because of the air conditioning system, this particle will be brought to the ceiling and then go down on the side of the wall, go down on the side of the wall. I'm sorry today, let's redo this. So the particle could go down, and a part of the particle will be exhausted through the outlet, but still many particles will be recirculating in this cabin for about 2 to 3 minutes. And this situation go on and on for the entire duration of the flight. But you also can see that this particle, generated in the middle of this row, and getting more and more diverse. And that means they can be dispersed to 3 rows before and 3 rows behind this infected patient. So let's prove that if you sit with a sick person within these 3 rows, then the risk of being transmitted is pretty high. Now, we also have done the experimental measurement to validate our model. So this is an airplane at the Tianjin University in China. We could use it to do the measurement. And our measurement was done in a first class cabin. And we release the particles in this seat. And then we measure the particle concentration in the breathing level of the other passengers, as you can see on the right bottom figure. Now, this chart shows the particle distribution over time. Okay, so you can see this is the index patient, and then others are just passengers. So those circles represent the mean data from the measurement, and the lines is from our models. We look at the red one is the model we use, and you can see they are not in perfect agreement, but it's reasonably good. Okay, so we have to say that our model seems to doing pretty good job in calculating the particle distribution. So then go back to this chart again. You know, this chart shows that, of course, a lot of people get infected just within this 3 rows before and 3 rows behind. But why there are some passengers who sit maybe 7 rows away, still get infected? So we suspect that the moving person in this cabin could cause the problem because a human weight could carry the virus. So to prove that, we did the simulation with a moving person along the corridor, and you can see his or her weight definitely carry a lot of virus, and this virus could be transported to people 7 rows away. This is an index patient there. Okay, but of course for this one, we couldn't really prove this is true because a lot of data was missing, and we cannot reproduce this. But this is just a possible scenarios. Okay, then people can say that then maybe in 2003 it's possible because SARS may be transmitted through airborne. But how about the COVID-19? And now with the 1 year after COVID-19, we have enough information to do the scientific investigation. So we are using now a Vietnamese flight from London to Hanoi on March the 3rd, 2020. So that's 10 months ago. And there was a passenger sitting in a business class cabin who infected 13 fellow passengers. And we know that this passenger coughed a lot during this 13 hours trip. So from the literature, now we know that when you cough, you could generate the particles or droplet in different size, as you can see on the left side of this slide. And also we know the number. And then for each droplet, we also now know how many COVID-19 viruses there. So with this information, we could simulate what happens in this business class cabin. Because in this business class cabin, we have all very detailed seat information. They are ensured with a pretty high partition wall. And the index patient is sitting here. And now he is coughing. And then, of course, you can see this flow pattern. Again, on the left side is clockwise, on the right side is counterclockwise. And you definitely see this droplet is spread again, like because this is business class cabin, right? Their seat pitch is much larger. But you can see it's really more or less dispersed to the entire business class cabin. And what we have done, again, is with the different particle size. Very large particles will not spread too far. And this is about 4 minutes. So this is more or less the same as what the airline tell you. Their air change rate is very high. In 4 minutes, the air becomes clean again. But of course, within these 4 minutes, this patient will cough already two or three times. Then with this result, we can calculate the values inhaled by all the passengers. So the top figure shows the seat of this business class cabin. And you see the index patient is 5K, okay? And those in brown color are actual and also simulated infected patient. So which means the agreement between simulation and the actual situation is an imperfect agreement. However, our simulation show the passenger 4A and 3G, which is in blue color, should be infected, but actually they are not. And of course, this might due to the different immune systems, etc., or your health condition. And we also find that the 3D actually was infected, but our simulation did not show that. And those in yellow colors, which were passengers who were not infected. And that was also both predicted and actual situation showed that they are not infected. So this again just proves that, the airborne transmission is there. Because especially in business class cabin, people don't know each other, so they hardly communicate to each other. They don't have a very close contact. So airborne transmission, we believe this is real. Now, what can we do? Okay, we said that using masks now in the USA, the government says using masks is important. And this is not a study done by us. Some other people did the study show that with an N95 mask, the efficacy is about 90%. So if one person spread like 1 million of disease, the mask will take 90% out. So only 100,000 particles will go to the air. And if a suspected person also wear the N95 mask and with the efficiency of 90, then the combined effect, you have a 99% of removal efficacy. And even with the surgical masks, your total removal efficacy is about 90. But when you use bandana, or if you use cloth mask, then efficiency is very low, but about 20%. So I did not encourage people to use the bandana or cloth mask. I think that the surgical mask is a minimum requirement. And of course, in the airplane, you can see sometimes people use a face shield. And this result, again, is done by other people, which show that face shield is not helpful. And that's because large droplet will go to the floor anyway, and small droplet, you cannot block that with the face shield. You will go with the air. So as soon as you breathe in the air will contain the virus. And then we just try to simulate the effect of this mask in a flight. So by using N95 mask, the left figure shows that for a 4 hours flight, and we use the flu as an example, 2 out of 11 passengers will get infected. Okay, this is a half of a twin aisle cabin. If you look at the whole air cabin, then 4 out of 18 passengers will get infected. But with the N95 masks, we see there's no problem at all. And therefore, wearing masks is very important. And now, of course, all the airliners mandate the passengers, they should wear masks. Otherwise, they will be forbidden to fly for the rest of their lifetime. We also developed an advanced ventilation system to mitigate this type of problem. And what I'm showing here, right, this is a new system we developed together with the Boeing company. So we put the air supply just underneath the seat in front of you. And then this air supply is toward your breathing zone. So as a result, this air will go up and then exhausted in the ceiling level. So we don't try to mix. This is very different from the conventional design. But of course, you like the leg space. So therefore, we do not put this diffuser just in front of your leg space. We put it just somewhere between these two passengers, all right? So then your leg space is still there. Normally, you have this place, you see the electronic boxes there. And we also built up a mock-up. We put the dummies in, and we have this air diffusers there. And the diffuser, you see the vents that supply the air upwards. And now I wanted to show you the result. Okay, so we use a Boeing 737 as an example. And we have an indentation to release the particles. And the first I wanted to show you the current system, okay, existing system. So you see this particle goes up and then the air will bring it down. And because of the air is fluid, so the particles could go to the other side. And then this also getting, transmitted along the longitudinal direction. So many people will get infected. Now with our new system, okay, we do the same thing. And because of the air now is supplied in the lower part, and then exhausted in the upper part. So you can see there's very few particles could go to the other side of the ion, and even the transmission along the longitudinal direction is minimal. And we have done further study by assuming on different source location, could be on the I/O, in the middle seat, on the window seat. And we find that with the current system, the risk for SARS infection will be 23%. And with our new system, it will be 15% if everyone does not wear masks, right? And this is for a 4 hours flight. And if we look overall together, we find that on the right side, our new system will reduce the risk by 50%. So to conclude my presentation, we find that the current ventilation system in a commercial airplane has very limited longitudinal flow, but the particle generated from a cough or whatever could be transmitted 3 rows before and 3 rows behind the patient. And moving people in an airplane could bring the particles to many rows away. We show you 7 rows away. And the CFD could predict the airborne, the SARS-CoV-2 transmission. And this is COVID-19 virus transmission in an airplane. And using our mask can help reduce the infection risk. And the new ventilation system, we call this underfloor air distribution, can help reduce the risk. So thank you very much.